And let's bring in ABC News medical correspondent Dr. Jennifer Ashton now, who just got her first dose of the COVID vaccine this morning. Now, some doctors at the hospital where she performed surgeries had already received it. Dr. Ashton was in the second group, and she's joining us now live to share more about her experience. Dr. Jen, good morning. I see you showing it off loud and proud. How do you feel?
I feel great, Diane. Boy, it was an emotional morning for sure. As you mentioned, I received the vaccine at my hospital, Englewood Health in Englewood, New Jersey, where I performed surgery. I was in Group 2, so I had to wait through all the people in Group 1 who were offered their spot. I got the text email notification on Thursday night saying my turn was up. I immediately jumped to register a time slot, and their vaccination process is going really smoothly. They're starting Group 3, I believe, tomorrow. And I just feel an incredible sense of gratitude to the people who worked to develop this vaccine, who participated in the clinical trials, and for all the people who have lost loved ones to COVID-19. This vaccine will hopefully eventually put an end to that.
Now, one of the things I find really interesting is we've heard so much about allergic reactions and how people who have severe allergic reactions might not want to get the vaccine or should talk to their doctor. And you actually have had severe reactions to food allergies.
Correct.
So how did you make the decision to get this vaccine anyway?
So I'm getting so many questions about this on my Instagram, Diane, and rightly so. There are a lot of people in this country who have allergies to foods or drugs. Number one, let's talk about big picture view. Background risk of an allergic reaction, a serious one following any immunization, is cited at an estimated 1.3 cases per 1 million doses. What do we know about this vaccine? Well, obviously, it's just starting to be administered. So the CDC released numbers just yesterday saying out of 272,000 doses, they have 6 reports of severe allergic reactions. That breaks it down, doing some simple math, to a risk so far of 1 in 45,000. For me, for you, for the average person, the risk of COVID, way higher than 1 out of 45,000. So for me, it was a very easy way to make the decision. Also, the American College of Asthma, Allergy, and Immunology says that even for people with serious allergies to foods or medications or drugs, they are at no higher risk than the general population to this particular vaccine. If you know you're allergic to the ingredient polyethylene glycol, then you should not get this vaccine. But otherwise, I had my EpiPens ready. It was in a medically supervised area, obviously in a hospital. There were paramedics there for everyone who were waiting their 15 to 30 minutes. And I did consult my personal allergist. You know, even doctors have doctors who recommended that I take an over-the-counter Zyrtec about an hour before, which I did. But I was not worried. I feel totally fine. And for me, that risk versus risk, no question which direction I was going to go.
Very well explained. And we should mention that in major pharmacies, people think, oh, well, that's in the hospital. But if I get it in a pharmacy, even the pharmacists who regularly administer vaccines have experience on dealing with allergic reactions. So, you know, it is worth noting that even the pharmacies are prepared to deal with this kind of thing.
And that's correct. They have epinephrine auto-injectors, which is reminded to everyone to be used as first line for an allergic reaction. But again, the risk is very low. However, people need to understand that as we start setting upon this path to vaccinate 100 million, 200 million Americans, we are going to see more reports of allergic reactions. The key is whether you can anticipate them, appropriately deal with them in a medical sense, and again, how high that is compared to a background risk of severe allergic reaction, and that is going to be tracked very, very closely.
And you seemed a little bit emotional right after getting this vaccine. How significant was it for you to have that moment finally here?
Oh, Diane. Well, you know that I'm a mom of 2. I'm the only parent my kids have, and I didn't realize it until that needle was in my arm, that this whole year, while reporting on this story, while taking care of my patients, I had really suppressed my own fear of getting COVID and potentially dying of it. I'm not worried about dying because if you're dead, you're dead, but I am worried about leaving my kids without a parent. So for me, that that was what was going through my mind when I got this vaccine, is that obviously I'll die of something else, but I'm not going to die of COVID. And that, as a mom, that was everything to me.
Well, we could see it in your eyes and hear it in your voice, and we know how much you open up your heart to us all the time, but we appreciate you taking us on this journey as well. So many people have so many questions about this vaccine, and like so many other things in this pandemic, you have been at the forefront of answering those questions for all of us, Dr. Jen. Thank you.
Thanks, Diane.
Much love to you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.